When you walk into a hospital or a clinic and you take a look at all the medical equipment and devices around you, so you ask yourself, how many things are actually made in the Philippines? And I'm not going to be surprised if your answer to me is almost nothing. So in order for us to be able to provide our citizens the most relevant and the most cost-effective equipment and devices, it probably will be best if we actually had it or had some supply here in the Philippines.
The UP Surgical Innovation and Biotechnology Laboratory, or the UP SIBOL, was started as a response to the frustration of surgeons and healthcare providers who feel they have failed to deliver optimum care to their patients because of the inadequacy, incompatibility, unaffordability of imported medical devices. This sustainable response is through local innovation of surgical devices adapted to the health needs of our people.
I remember both the Chancellor and the Dean actually talked to me asking me, would you like to or would we like to come up with a program addressing these problems, biomedical equipment and devices? Without that kind of support, you wouldn't be able to come up with these collaborations.
SIBOL is a multi and cross-disciplinary field spanning many subfields of engineering, and artificial intelligence and computer science is just one among the several or the many fields that are collaborating.
The biggest influence that SIBOL had ay sa mga students. Nagkaroon tayo ng elective class that is handled by Ms. Rox De Leon and Dr. Edward Wang. So this elective provides students some kind of awareness and appreciation para sa biomedical engineering.
One of the biggest strengths of UP SIBOL as an organization really is the people that are part of the group. We get very excited thinking about what we can do, how we can grow the organization, how we can provide opportunity for the engineering students and innovators who want to develop something for the Philippines.
Within the next 5 years, I can fairly say that there is an increased interest in the biomedical engineering and biomedical sciences as a result of the pandemic, that we are really now concerned about coming up with solutions, preparing for the future and the next pandemic.
I think from a general standpoint, our society will benefit from cultivating a culture of innovation and collaboration that is well recognized and supported in various aspects, whether logistical, financial, or even administrative. So I think if policies are in place to encourage careers in this field without us having to worry about encountering significant resistance or roadblocks, I think this will be a great way to inspire more innovators and inventors.
I worried about the healthcare workers who were forced to stay in 8 or even 12-hour duty schedules inside a contaminated area. We needed to help them breathe better, as well as protect them from most of these contaminants.
The constraints of the pandemic was a big challenge in itself, and the lockdown really barred us from doing site visits and in-person meetings. But I guess that didn't stop it because we have online conference platforms right now.
In PGH, which is a COVID referral center, we attend to a lot of pregnant patients, both that are due to deliver and both that are undelivered but have COVID-19. I think it was last August when we had a very young patient who came in with COVID-19, severe pneumonia, and she was intubated, placed on prone, and unfortunately the outcome was not very good. She did not survive. But then when we went into discussions, we were asking the residents, how did you put her on prone? And they expressed the difficulty in putting her on prone and on monitoring her. And it impacted me so much that I said, we can do so much better for our patients.
The usual procurement practices of UP, it was actually okay. But the problem was the materials that we need are not the usual materials that UP procures. So we had a hard time finding vendors no, to agree on what we need, and then actually some of the materials that we need were procured from abroad.
The main challenge was actually the distance, since the doctors are based in UP Manila and we are based here at UP Diliman. So communication was only through Viber. Then when we needed parts, they had to send it over using some kind of courier. So for bigger parts, it was harder to send over.
So as an engineer, it was really something new for me. So it was crucial that we had clinicians in the team to help us through the process.
As clinicians, we are not, personally, I'm not accustomed to doing biomedical devices. No? So what I can provide is the clinical expertise and opinion on the uses, the principles, but basically on creating them, I have no experience. So that's where the engineers come in.
Collaborating with clinicians, industrial designers, visual communication experts, among others, has made a lot of difference in our research practices.
We need an investor who will believe in our product and actually invest in making it, increasing its commercial readiness.
What really makes me happy ultimately is being able to see that patients and other people benefit positively from the things that we do. When they tell us that our innovations have helped them, have given them more than just the physical healing, but more on the general wellness, yung kagalingan.
Yung pet peeve ko, giving us the bureaucratic and the legal space to operate at a much faster pace. Kasi talaga, a lot of these rules are becoming, are no longer helpful in this fast-paced, innovation-driven world that we are live in. Sad to say, as much as we want to follow the rules, I think it's time now for the rules to adapt, to adjust to the new realities.
SIBOL is very daring. So we are looking at projects that we have not worked on before. We have a very dynamic group of clinicians as well as computer scientists and engineers working together. And with this, I think by being very daring and thinking of big projects, we can go very far.
But I think with adversity comes opportunity. And I would like to say that UP SIBOL was a perfect example of how this was in full display.
It's not enough that we know that we can build it. It's useless. It's just good intentions at the end of the day if we do not make it translate to the common healthcare worker.
But again, at the end of the day, whatever we can contribute, we feel very happy that we had this chance. I guess not all people will have this chance.
And hopefully, people really get to notice this one, no? Notice SIBOL, really support it 100% and notice its relevance, no? Na ngayon, parang medyo tumingkad siya because of the COVID-19 pandemic. Sana tuloy-tuloy ito. Kahit walang pandemic, tuloy-tuloy pa rin po siya.